Welcome to Wax Off. My name is Robina Rayasat and I'm a hearing aid audiologist. I'll be talking through our earwax removal videos, so let's see some wax. This patient, let's call her Liana Mormont. Liana's earwax removal will be a very short video today because she actually doesn't like anyone examining or touching her left ear because it's dead. So I'll be showing you just the right ear in this procedure. Because of Liana's mobility, I'm also not able to get her into a laying or a tilted position where the oil or any other drops gets deep down enough. So everything will look super dry as I'm carrying out the procedure. Now, as you can tell, I started the procedure off with the suction probe and it wasn't doing much. So I'm now switching to the alligator forceps to get a better grip on the wax. Now I'm clamping on the edge and it is moving it further out into the entrance of the ear canal, but it's not quite holding on to it as I'd like. So as I'm re-entering the ear canal, you can see that as I clamp on again, it's actually quite a long ribbon of wax and a small area of wax has come away there. So I'm going to keep trying the same motion of clamping on and pulling the wax out, and again another piece comes off. As I'm going back in, I'm trying once again and again a third time, a little amount breaks off. So I'm switching back to the suction and I'm trying a slightly rocking motion. You can see it hasn't actually done much to it apart from move it to the side, but at least we know now that the probe isn't going to work. So once again, we're back with the alligator forceps, and there you go, a larger amount has come out there. A nice still in a few seconds, just to show what it looks like. It's quite a large, long piece. It has quite a lot of hairs stuck in it, and can see it's come out quite nicely. So we're going back in and using the same clamping, deep clamping technique, and another huge bit comes out of the wax. Again, a lovely still there to show you what it looks like close up, and that should actually have removed most of it, but you can see going back in there is still quite a lot of wax there. So we're switching back to the probe to see if I can bring it further to the entrance of the ear canal, even more so than before. But it's just allowing a small piece to come away there, which is emerging, and I'm happy with that. Back in with the probe again. Now you can see that there's quite a lot of wax still there, but it's firmly stuck to the side of the ear canal, and the probe isn't really doing much to it again. And this wax is a little bit more softer compared to the outer wax, so I decided to go back in with the forceps and try the deep clamping motion again. And that seems to actually be pushing it further down, and little bits are coming off. But suddenly we get a good angle on it, and suddenly it comes away. It's broken off a little bit there, but I go back in to take it off, and the whole amount of wax that was in there before suddenly comes away. And you can see as I turn it around, it actually follows the shape of the ear canal, so it's round in the middle. So here, ladies and gentlemen, is the final shot of the eardrum. Those who have a keen eye and passion for anatomy, you'll instantly know that this eardrum does not look normal. It is retracted and has lots and lots of calcification and tympanic sclerosis, and the light reflections are all quite incorrect, not what we would expect to see. Liana's GP knows about her retracted eardrum, and her hearing does fluctuate with it, so she has received the correct medical attention she needs for this eardrum, but the GP and the ENT together haven't been able to completely resolve what is causing this, so every time I see her, this is what her eardrum looks like. So that's the end of episode 18. Thank you so much, everybody, for watching. Please do continue to like, subscribe and comment, and I will see you in the next one.